Good day, everyone. My name is Mery Zulueta. Today, I will be presenting about sexual problems. Here's the objectives to define the sexual problems, to know the categories of sexual problems, and to identify the causes of the categories. Sexual problem is a problem that can happen during any phase of the sexual response cycle. It also prevents you from experiencing satisfaction from sexual activity. Sexual problems may be classified as physiological, psychological, and premature ejaculation. Any given problem may involve all three categories. A physiological problem, for example, will produce psychological effects, and this may result in some social maladjustment. So, here is the first category of sexual problem, the physiological problem. Physiological problems are the least among the three categories. Only some people suffer from diseases that are due to abnormal development of the genitalia or the part of neurophysiology controlling sexual response. Some common physiologic conditions that can disturb sexual response include vagina infections. Many people, however, experience at some time sexual problems that are byproducts of other pathologies or injuries. Vaginal infections, for example, retroverted uteri, prostatitis, adrenal tumors, diabetes, senile changes of the vagina, and cardiovascular conditions may cause disturbance of the sexual life. In brief, anything that seriously interferes with normal bodily functioning generally causes some degree of sexual trouble. Here are the physiological causes. The first one is the diabetes, neurological disorders, hormonal imbalances, alcoholism, and drug abuse. Fortunately, the great majority of physiological sexual problems are solved through medication. Generally, only those problems involving damage to the nervous system defy therapy. The second category is the psychological problems. Psychological problems comprise by far the largest category. They are usually caused by socially induced inhibitions, maladaptive attitudes, ignorance, and sexual myths held by society. An example of the latter is the idea that good mature sex must involve rapid erection, protracted coitus, and simultaneous orgasm. Magazines, marriage books, and general sexual folklore reinforce these demanding ideals, which cannot always be met and hence give rise to anxiety, guilt, and feelings of inadequacy. Psychological causes. The first one is the work related stress and anxiety. Next is the concern about sexual performance, depression, feelings of guilt, concern about body image, and effects of a past social trauma. So, kanang concern kay ka sa imong image, imong lawas niya, epekto pod sa past nimo nga nagian nimo nga trauma. Next is the premature ejaculation. Premature ejaculation, it is a common problem especially for young males. Sometimes, this is not the consequences of any psychological problem but the natural result of excessive tension in a male who has been sexually deprived. In such cases, More frequent coitus solves the problem. Premature ejaculation is difficult to define. The best definition is that offered by the American sexologists William Howell Masters and Virginia Eshelman Johnson, who say that a male suffers from premature ejaculation if he cannot delay ejaculation long enough to induce orgasm in a sexual normal female at least half the time. Katunga ra daw sa oras. This generally means that vaginal penetration with some movement, although not continuous, must be maintained for more than 1 minute. The average American male ejaculates in 2 or 3 minutes after vaginal penetration, a coital duration sufficient to cause orgasm in most females the majority of the time. Various methods of preventing premature ejaculation have been tried. One is for the male to excite the female for during the foreplay so that she reaches orgasm more rapidly after penetration. But this technique often excites the male as well and defeats its purpose. Other common method is for the male to think of non-sexual matters, which may prove effective by reduces his pleasure. The most effective therapy is that advocated by Masters and Johnson, in which the female brings the male nearly to orgasm and then prevents the male's orgasm by briefly compressing the penis between her fingers just below the head of the penis. Ulo ko na. The couple come to realize that premature ejaculation can thus be easily prevented, their anxiety disappears, and ultimately they can achieve normal coitus without resorting to this squeeze technique. So, erectile impotence is almost always of physical uh no erectile impotence is almost always of psychological origin in males under 40. In older males, physical causes are more often involved. Fear of being impotent frequently causes impotence, and in many cases, the afflicted male is simply caught up in self-perpetuating problem that can be solved only by achieving a successful act of coitus. In other cases, the impotence they may be the result of disinterest in the sexual partner, fatigue, distraction because of non-sexual worries, intoxication, or any causes. Such occasional impotency is common and requires no therapy. Some males, however, are chronically impotent and require psychotherapy or behavior therapy. Such impotency is thought to be the result of deep-seated ca- casual factors such as unconscious feelings of hostility, fear, inadequacy, or guilt. Primary impotence, the inability to ever have achieve erection sufficient for coitus, is more difficult to treat than the far more common secondary impotence, which is impotence in a male who was formerly potent. Ejaculatory impotence, which result from the inability to ejaculate in coitus. It is uncommon and is usually of psychogenic origin. It seems associated with ideas of contamination or with memories of traumatic experiences. Occasional ejaculatory inability may be expected in older men or in any male who has exceeded his sexual capacity. Vaginismus. Vaginismus is a powerful spasm of the pelvic musculature constricting the vagina so that penetration is painful or impossible. Sakit daw niya. Imposible sad siya. So that's all, and thank you.